Hi, everybody. Thanks so much for joining us today. We've got a great guest that is going to be speaking to all of us tonight about the way in which COVID-19 is wreaking havoc across our communities, but in a way that up until just a few days ago, most folks actually hadn't been paying a whole lot of attention to. So Andre Perry has dedicated his life to understanding the social inequities and racial inequities in America and across our society. He's going to speak to us tonight about the fact that, well, many of us frame COVID-19 as this great equalizer, the fact that it does not discriminate, the fact that anyone can get sick. Well, obviously, yes, that's true. But the data that is emerging across cities like Boston, New York, New Orleans, Detroit, Chicago, is that there's actually some pretty stark statistics about who actually gets the sickest and who actually is in our hospitals, who's on intensive care, and who's passing away. And it often comes down to men, and particularly African American men and people of color. And so Andre's going to be here and start to pull back those layers of it and talk about why that actually is and what we need to do about it. He's got a great book coming out as well called Know Your Price, which evaluates Black lives and Black property in Black cities across the country. So take a look and welcome Andre. Thank you so much for joining us this evening, everybody. I am thrilled to have Andre Perry here with us this evening, who is a fellow at the Brookings Institute and is the author of the forthcoming book, Know Your Price, which is, I think, going to be required reading for anybody that is aware of or wants to learn more about and is ready to confront the structures that have disenfranchised and still limit the potential of not just every single person in our country, but the opportunities that our country and the promise that our country makes to everybody, and the opportunities that we have to actually realize our future as a nation. And so Andre's been dedicated his life to scholarship on these issues, and I think has a really important perspective to add to the impact of coronavirus and COVID-19 as it's wreaking havoc on communities across our country. But not everyone equally. And I think, I don't want to put words in his mouth, but I think, as he would say, not a surprise. So Andre, thank you very, very much for joining us this evening. And let me just start by saying, kind of building off of that a little bit here, we have seen in the past 24 hours an explosion of headlines in national newspapers and even local ones here in Boston about data that is, many have been surprised by that. I don't think you are. Why not?
Yeah, I'm not surprised. And just to let folks know, if they have not heard the news, that in places like Chicago, 70% of the COVID-19 deaths are among Black people, but the city's population is just 30% Black, just to put that in perspective. Same is true in Michigan, where Blacks are disproportionately dying from COVID. In New York City, we also know that upper class white zip codes have seen fewer cases of COVID-19. And in Italy, and just taking this to an international level, Italy and China, COVID-19 took a disproportionate amount of men's lives out of commission. So this is a disease that is impacting the vulnerable. Now, what causes someone to be vulnerable? Clearly, the COVID does not discriminate. However, our past policies have. So in terms of housing, when you're going back as far as the 1930s, when we redlined Black neighborhoods and deemed them too risky to give loans, that perception has translated into other areas where Black people are seen as risky. And so there's been less investment in Black people and places where Black people live. Same is true in terms of where we work. Black people and brown people are disproportionately in occupations that are on the front lines of this epidemic. So they are the retail cashiers. They are the frontline workers. They also work in the health professions at a higher rate. But men, it's interesting, particularly around Black men. Our rates of heart disease and stroke are higher, largely because of things like environmental racism, stress, a lot of factors that go beyond sort of this narrative that the conditions of Black people and Black places are a result of the direct actions of the people. There are policies in place that put folks in position to eat, work, sleep in areas that are prone to make someone sick. So there's no accident here that we're seeing a disproportionate number of people of color, and particularly men, who are inflicted with this illness.
So we're making a big push on data because you cited a number of statistics. I think Louisiana has come out with some as well, New Orleans in particular. But in Chicago, Detroit, you mentioned some. Massachusetts actually hasn't disclosed a whole lot of information, although we're pushing pretty hard on the state level there to get some of that information out. Why is it so important to have it, and what do you hope what do we hope to gain by getting it?
Well, as a researcher, if I want to answer any kind of question, I need as much data that will enable me to answer it. We know that if we look at race, we'll better know how this disease is spreading. The reality is that why there's such a reticence to report race data, because state departments have these data. It's there. It's a decision not to report these data. And that's because Black and brown people are devalued. We want to say, and you hear this all the time, we're all in this together. But being in this together means understanding that anti-Black, anti-immigrant legislation is literally killing people. That the policies of the past make us vulnerable to the inevitable shocks to systems of the present and future. And so if we're going to correct and level flatten the curve, if you will, we have to level the playing field by making sure we invest in the people that are suffering. And that means when we roll out these bills, finding ways to fund the agencies that are proximate to the suffering. So the fund managers, the CDFIs, the Black banks, these organizations that have relationships with Black communities. We have to fund those and make sure that those resources get to people of color. I love there's a lot of great aspects about this current bill. Anyone who's been through an emergency like Katrina, like I've been, understands that the SBA and FEMA, that combination did not yield a lot of success for Black and brown communities. With that said, it was with banks. Remember, banking is a relationship-driven business. And so although the banks have guaranteed loans to let out to business owners, that many Black people just simply do not trust the banks that are letting these loans, even though they're guaranteed. And so it's important, again, to make sure we bolster the strength of these Black and brown-led institutions because they are trusted. With that said, many of these institutions honestly don't have the capacity to deal with the volume that they will see. And so I've been asking folks in Congress to, if we're going to bail out and enrich banks and big companies, that they lend their support to smaller agencies to build up the capacity. And so it doesn't take much for a fintech company to lend out technology to a Black bank, a CDFI, for instance. And so for this epidemic, we have to find ways to use the short term and God willing, short term emergency to produce long-term solutions to prevent the next inevitable disaster from producing more inequalities.
Let me flesh that out a little bit, because I think what you said is super important. And again, not just an academic concern, because you lived through this with Katrina, right? Where this extraordinary environmental disaster that led to a rebuilding of an entire region of our country. But that the agencies that then were empowered to actually support communities did not do so, or were not actually constructed initially to actually do that, right? To be somewhat fair to SBA, right? But now SBA wasn't constructed to just disperse $350 billion in a matter of weeks either, right? Which is a legit concern now to get that money out. Just that's not what it was built to do and designed to do, and so there's going to be a backlog with it, right? But knowing what we learned, knowing what we saw and what we learned from Katrina, and the observation, you just released a bunch of research on this about the impact for Black-owned businesses and what this is going to mean, particularly in these communities that have been disproportionately affected because they are minority communities, immigrant communities, lower income communities, healthcare deserts, et cetera, that impact is going to snowball. And we know that because we've seen it before, we've learned it. The policies are still built upon legacies where this was the case, deliberately and intentionally so. So how do we make sure we actually do better on this time for those minority-owned businesses if we want to build out of this as quickly as we possibly can?
You know, if there's a lesson learned from this epidemic, is that under an understanding of how interconnected we are, that when our neighbors are sick, then we are vulnerable. And we see that medically, but we don't get that economically. The same principles apply. You don't see how the hurt of Black and brown people are affecting the entire economy, because largely we measure the health of economy largely in the aggregate that mask what's going on in the cities and in rural communities. But our economy would be so much stronger if we shored up the resources for the vulnerable, protecting our neighbors. And if we can direct resources to teachers, to healthcare workers, physicians, let's not forget, physicians are on the front line and they're struggling just like everyone else. If we can find those ethnic groups, those areas of the country, rural areas, that we know are vulnerable to seeing a downturn after this is over, it's incumbent upon us to beef those areas up. I'll just give you a couple of examples, again, drawing on my Katrina experience. The number of retirements and from the teacher ranks spiked after Hurricane Katrina. People got out of the profession altogether. In addition to a lot of firings after the hurricane, the Black teacher population went from 73% to about 50%. And it has yet to recover. And so the point is, there are going to be jobs, occupations that are hit hard because people of color proliferate them. But we have got to do our job in making sure that that slide doesn't occur. And that means being very targeted with our resources and providing the support to agencies that have a good track record of working with people of color.
So I want to take that one step further here. As you might know, you might not. So healthcare has been a big area of focus for me, and one of the areas that I have focused on an awful lot over the course of the past couple of years, in part because of my own just personal experience. I now have two young kids, a 2-year-old and a 4-year-old, but has been maternal mortality. And your wife is a rock star, actually, when it comes to this topic, right?
Yeah.
Particularly with regards to the disparities that we see with regards to healthcare outcomes for particularly African American women, right? When adjusted, so before anybody tries to say, oh, well, this could, is influenced by the social determinants of health, even taking into account income and education level, an African American woman is still 3 or 4 times more likely to die during childbirth than a white woman. And a big part of that is structural racial bias within our healthcare sector and implicit bias, right? So people don't intend to do things necessarily, but without question, the data shows that African American women, pregnant moms, are not listened to, not heard. Their concerns not taken into account the same way as somebody else is, and we see the outcome of that in the data in just tragic ways. Given that's the impact for our healthcare sector, given that this is a healthcare and now economic crisis that is going to amplify and reinforce each other, particularly in minority communities, what's the lessons to learn from this to try to actually break that cycle as they potentially reinforce each other?
Well, there's a couple lessons. First, I encourage everyone, all of your viewers, to make sure you pay attention to Dr. Joya Career-Perry. She's doing tremendous work. I'm not just I'm not saying that because she's my wife and she's looking over me right now.
I'm not either. She is a rock star. So
yeah, she is a rock star. She's a rock star. But she will tell you how you're not going to, that Black women can't buy or educate their way to better birth outcomes. Yep. At some point, we have got to invest in these, in changing the structures that produce early preterm death among babies and death among mothers. And I look at that almost as a principle in itself. If we can protect the most vulnerable, then we know that the rest of us will be okay. Black women are very powerful, but they're not protected. And it's important that in our policies that we're looking to change the criminal justice system, change the educational system, change the healthcare system in ways that reduces the stress on our bodies that manifests themselves in women in death of themselves and their children. So if in these emergent times, it might sound or seem counterintuitive, but if we don't address structural issues while we fix emergent ones, we'll be right back in the same place when the next shock happens. I mean, within my lifetime, I've seen 9/11, a tech bubble, a housing bubble, Hurricane Katrina, COVID, multiple hurricanes in the Gulf. And if we don't realize now that this is the normal, this is not a new normal for many people. And let's be clear, while we're in an era or was in an era of full employment, Black people were in a recession in many different cities. And so a lot of these issues go beyond this short-term epidemic. Black women are struggling to make sure that they have the resources and the policy change needed in order to get better outcomes. And we still have to work on that. But for some, this will be an easy distraction to say we have got to deal with these immediate issues, and we've got to put money in people's pockets now, and let's worry about these other issues later. People don't live their lives in that kind of segregated way. But so we've got to work on these emergent issues now, as well as the structural issues. And we've done this before. I just want to remind people that after the Great Depression, it was investments in poor people that led us out of the Depression. The same is true today. It will be an investment in the most vulnerable that prepares us today and a generation to come. In my new book, Know Your Price, I talk about how we can radically change criminal justice. We can improve our economic corridors so that Black and brown folks can open up stores and shops. We can deal with reproductive justice. All these things have to be done in this, and the time is now to do it. When else are we going to see this kind of money transfer to individuals, to companies, to communities? We won't, these moments don't come around but ever so often. And so when they do, it's imperative that we do our best to correct for the inequalities and disparities that will inevitably be exposed by the crisis.
I have been giving a lot of thought of late to what our country is going to look like when we come out of this, and hopefully that's soon. But whether that's, I mean, the real answer to that as to when we do come out of this is going to be when you've got a vaccine and when people have either had it or been vaccinated, right? And that's not soon, right? That's 18 months away, probably minimum. And the way in which we have to obviously fix our preparedness for our stockpile and masks and ventilators and whatever else that next iteration of this is, right? But the broader question that you just articulated and answered a little bit earlier, when it comes to a pandemic, you're not going to tax cut your way to success, right? You cannot, a gated community with a private school and a private police force and offshore accounts isn't going to save you out of this. What's going to save you out of this is the fact that the person next to you is healthy, and the person next to you has access to healthcare, and they have access to medication, and that we're not having to go through an act of Congress to ensure the fact that the cost of testing is going to be free, but the cost of treatment isn't. So if you actually get diagnosed with a virus, and a pretty high percentage of folks that go to the hospital need a ventilator, and if you need a ventilator for this virus, you are often on it for over a week. A friend of mine, his daughter, who was perfectly healthy, was on a vent for over 2 weeks. The bill that she's going to get, their family's going to get, is going to be hundreds of thousands of dollars. And thank God their insurance will cover it. If you're one of the millions of people across this country that doesn't have it, your financial future is just eradicated, right? That we are, in fact, linked in this. And the point that you made earlier, when we talk about those comorbidities, diabetes, right? Yep. Heart disease, COPD, those in and of itself, those are also consequences of structural affirmative decisions because of minority communities living in certain places because of legacy laws, right? And because of stress and health impacts and systemically. And now all of a sudden we're seeing this play out in real impact. I referenced before we got on the call, Chelsea, the community in Boston, just north of the city and east, the infection rate per 100,000 is at 96 at the moment. The next highest rate in Massachusetts is at about 60.
Right.
Brookline, where I used to live, is at roughly 20. Somerville's at 12, right? 5 to 7 times higher in a community that is largely immigrant, largely non-English, a large percentage that has English as a second language, largely multi-generational housing, high population density, and they're the service employees. They go to work.
Yeah.
I met with a couple, now about 2 weeks ago, Andre, in Boston, the folks that drive the bus, the T drivers, MBTA. And because the city was shut down, they had reduced the schedule to a Saturday schedule for the bus rides. Mm-hmm. The driver told me, he said, of all the routes, that 111 bus, the bus from Chelsea was packed. Yeah. Because if you reduce the buses, you got more people on them. And guess what? They all had to go to work because they don't get paid leave, they don't get paid time off, and they need the paycheck. And by the way, they're essential duties. Yeah. And what do you have 3 weeks later? You have the highest rate of infection in the state.
Yeah, I'm here in DC, and I go running every day. And when I'm running in my car, I'm running and I'm looking at the cars. I'm looking who's in them. I'm looking at who's driving the buses. I'm looking at who's still working. And I can't help but see people of color on the front line, risking their lives to serve us. It is heartening because the reality is we know that folks are working, they are picking up the COVID-19 and they're passing it on in their communities. And there's nothing that they can do because they have to make a choice between putting food on the table or not. And so they're going out and risking themselves to put food on the table, and people will die. And so it is just it's heartbreaking because it doesn't have to be. And by the way, that we will all be quarantined for a while until we deal with or make everyone healthy enough to come out. I have to say that people may not want to talk about universal health care. They might see this as a progressive democratic issue. But if we don't talk, which is good, with nothing wrong with that. But if we don't talk about a social safety net now, then we are really missing out. I mean, this is not just about healthcare, which is front and center, but it's also about unemployment insurance. It's also about education. There's so many different areas that
housing, transportation,
that's transportation. I mean, these things again these events will happen again, and are we prepared? No, we are not. And so instead of cutting taxes and enriching the few, we should be figuring out ways to protect us all, because now the risks are just way too high, way too high.
Amen. Andre, thanks for joining us. Know Your Price is the book. Pick it up, everybody.
Thanks for having me.
Really honored to do it. Stay healthy, stay safe, everybody, and be well. I'll see you soon. Take care. Andre, thank you. Thrilled to have you tonight, and thank you so much for the insight that you bring to the ways in which this virus is just showing the structural inequities and racial disparities that we see across our country. And I think more than anything, the fact that this moment calls us not just to highlight that injustice, but to actually do everything we can to address it and to heal it and to fix it from now going forward. Thanks very much, everybody. Andre, thank you. Take a look at his book, Know Your Price, coming out soon. Thanks so much.